Many of those people are just afraid they have COVID and want to get checked out. Not the right place.
And surging wait times at ERs and urgent care clinics. Why COVID is not the only problem they're facing and the impact it's having on potential patients. People are showing up for treatment only to face wait times for several hours right now. Glad you're with us tonight. I'm Matt Austin.
And I'm Lisa Bell. The demand for COVID testing and the rising cases is putting a strain on emergency clinics. It's also putting pressure on patients. News 6's Treasure Roberts joins us now from Orlando Regional Medical Center, one of the biggest and busiest ERs in our area. So Treasure, what kind of wait times are patients finding there?
Well, emergency rooms are seeing very long wait times. At last check, to be seen here at Orlando Regional Medical Center, you'd potentially have to wait up to 5 hours. And earlier, we saw wait times as high as 8 hours. I spoke with a man today who says it's just really frustrating, especially when you have a family member who's seriously ill.
I feel useless. I feel not strong enough just to take care of all this, and it's difficult.
Sergio Herrera, a shaken husband, pacing in a Navin Health waiting room, hoping his wife gets better.
She was taking the antibiotics, and she's just getting worse.
He says getting her checked in to be seen was no easy task. Herrera says he first brought his wife to the hospital Monday. After hours of waiting, they were sent home with prescriptions for medication. His wife took the medicine the next day, but it made matters worse.
She was vomiting. She just threw off all the medications.
So they came back to the emergency room Wednesday, where the couple and several other people waited for assistance.
It's heartbreaking. 5 hours or more, people from the morning.
Multiple hospitals in the area faced with the same issues. These two people posting on Twitter frustrated with wait times up to 13 hours.
So we've had some serious ER wait times. The emergency rooms have been slammed.
EMS Medical Director Dr. Todd Husty says it's a mix of high volumes of people and staffing shortages. But what makes it more chaotic is some people are showing up to the emergency room with non-emergencies.
If you have mild symptoms, which many people are getting with Omicron, stuffy nose, a little cough, a little sore throat, you're not dying. You're not even close. Do you need to go anywhere? No, you need to stay home unless it gets worse. Emergency rooms are for emergency, and you're not an emergency when you're just scared or nervous.
Dr. Husty says people who show up without emergencies are making it harder for others to get the help they need, like Herrera's wife, who's battling a serious case of pneumonia and COVID-19.
I don't know what to do right now. Sometimes I just get looking at heaven and the sky and tell the Lord, help me out, because I don't have the strength. I'm losing the strength.
After waiting for hours, fortunately, she's now being treated.
Dr. Husty also says that hospitals are triaging. That means that healthcare workers are taking care of people in the worst conditions first. That's another reason why you could be waiting a long time. In Orlando, Treasure Roberts getting results, News 6.
Treasure, thank you.